The silent warning you can't see. Right now, as you're watching this, somewhere in the world, a person is hearing these words for the first time. Someone just found out they have diabetes and they're shocked. You have diabetes, and in that moment, their mind starts racing. They feel like it came out of nowhere and start asking themselves, how did this happen? I felt fine. I didn't see this coming. But here's the truth most people never hear. It didn't come suddenly. It didn't appear overnight. Their body had been warning them again and again and again for months, maybe even years. They just didn't know what to look for. They just didn't recognize the signs. And that person could be you, your parent, someone you love, your best friend, or your partner sitting next to you on the couch. I know that sounds dramatic, right? But consider this, the reality most people don't know. The International Diabetes Federation estimates that over 422 million people globally are living with diabetes. And nearly 1 in 4, that's over 100 million people, are completely undiagnosed. They are walking around right now, going about their daily lives, completely unaware that their blood sugar is quietly destroying their blood vessels, their nerves, and their organs. Diabetes doesn't announce itself with a fanfare. It whispers. It sneaks up on you. It disguises its early symptoms as tiredness or getting older or not sleeping well. And by the time most people get a formal diagnosis, the disease has often already been doing damage for years. Don't rush. Why diabetes is so dangerous? Because diabetes doesn't shout. It whispers. It disguises itself as just tired, just stress, just getting older, just bad sleep. And by the time it finally gets diagnosed, the damage may already be underway. But here's the good news. Diabetes is one of the most preventable diseases in the world. And in its early stages, it can often be reversed or completely controlled, but only if you catch it early. And that's exactly what this video will help you do. But here's what's also true most people don't know. Diabetes is one of the most preventable and manageable chronic diseases in the world if you catch it early enough. Lifestyle changes, dietary shifts, exercise, and medical intervention can reverse prediabetes and dramatically slow the progression of type 2 diabetes. Early detection is not just helpful. It is the difference between a manageable condition and a life-altering crisis. So today, I'm going to walk you through 7 early warning signs of diabetes that most people completely ignore. These are not obscure, rare symptoms. These are signals that millions of people experience every single day, and most of them brush off as nothing. Watch all the way through. Take notes. Send this video to someone you love. Because the knowledge in the next minutes could change the entire trajectory of your health or someone else's. Watch this until the end, because the last section could literally save your life. Let's begin. Understanding what's happening in your body. Before we talk about symptoms, you need to understand something very important. Diabetes is not just about sugar. It's about how your body handles energy. Section 1. How diabetes develops. Before we dive into the warning signs, I want to make sure you understand what's actually happening inside your body when diabetes begins to develop. Because once you understand the mechanism, those 7 warning signs will make complete, logical sense. Every single cell in your body needs energy. And the primary fuel source for that energy is glucose, also known as blood sugar. When you eat food, especially carbohydrates, your digestive system breaks it down into glucose, which enters your bloodstream. Here's where your pancreas comes in. Your pancreas is a gland sitting just behind your stomach, and one of its critical jobs is to produce a hormone called insulin. Insulin acts like a key. It unlocks the door on your cells so that glucose from the bloodstream can enter them and be used for energy. In a healthy body, this system is elegant. You eat, blood sugar rises, pancreas releases insulin, insulin opens cell doors, glucose enters cells, blood sugar normalizes. Clean, simple, efficient. But in diabetes, this system breaks down. And there are two main ways that happens. In type 1 diabetes, the immune system, for reasons we still don't fully understand, attacks and destroys the insulin-producing cells in the pancreas. The pancreas simply cannot make enough insulin anymore. This is an autoimmune condition, usually diagnosed in childhood or young adulthood, and it requires insulin therapy to survive. In type 2 diabetes, the far more common form, accounting for about 90 to 95% of all cases, the problem is different. First, the cells of the body stop responding properly to insulin. They become resistant. The keys stop working as well. So the pancreas tries to compensate by pumping out more insulin. But over time, the pancreas gets exhausted and can't keep up. Blood sugar levels start to rise and stay elevated. This is type 2 diabetes. And before you reach full type 2 diabetes, there's a middle stage called prediabetes where your blood sugar is higher than normal, but not yet high enough to be officially classified as diabetes. This stage is critically important, because at this point, with the right changes, you can often reverse course completely. So what does chronically high blood sugar actually do to your body? Everything. It damages the walls of your blood vessels, both large and small. It impairs nerve function. It affects how your immune system responds to infection. It changes how fluids are regulated in your kidneys and eyes. It disrupts circulation to your extremities. And all of these effects, these biochemical disruptions, manifest as symptoms. Symptoms that your body is desperately trying to communicate to you. The 7 warning signs we're about to discuss are not random. Each one is a direct, logical consequence of what high blood sugar is doing inside your body. Sign 1. Excessive thirst, polydipsia. Have you ever felt like no matter how much water you drink, you just can't quench your thirst? Like you're drinking glass after glass and your mouth still feels dry, almost like the desert? That sensation has a medical name, polydipsia. And it is one of the most classic and most ignored early warning signs of diabetes. Why does this happen? When your blood sugar levels are elevated, your kidneys work overtime to try to filter and remove the excess glucose from your blood. Here's how. Your kidneys normally reabsorb glucose back into the bloodstream as blood is filtered. But when there's too much glucose, when it exceeds what's called the renal threshold, the kidneys can no longer keep up. So the excess glucose gets excreted into the urine. But glucose doesn't travel alone through the kidneys. It drags water with it through a process called osmosis. The glucose molecules, being solutes, pull water out of your tissues and into the urine. The result? Your body loses a significant amount of water, much more than it should during normal urination. This loss of fluid triggers your body's thirst response. Your brain senses the dehydration and sends out alarm signals. Drink more water. And so, you drink. But if your blood sugar is still elevated, the cycle continues. You drink, your kidneys filter out more glucose, they take more water with it, you lose fluid, and you're thirsty again. It's a relentless, self-perpetuating loop. What does this feel like in real life? This isn't the normal thirst you feel after a workout or on a hot day. People describe it as a persistent, deep dryness, particularly in the mouth and throat. You might wake up at 3 a.m. desperately needing water. You might keep a water bottle with you constantly and still feel thirsty. You might notice your lips cracking more easily, your tongue feeling thick, your throat uncomfortable regardless of how much you drink. Some people consume genuinely alarming amounts of liquid, 4 or 5 liters or more per day, and still don't feel hydrated. That's a red flag. What people tell themselves. Instead, I just don't drink enough water normally. It must be the salty food I've been eating. I've been stressed. Stress makes me dry. I just feel better when I have lots of water around. These rationalizations make total sense. But here's the distinguishing factor. In diabetes, the thirst is chronic. It doesn't go away after a good day of hydration. It's relentless, week after week. What makes this sign easy to miss? Because drinking water is almost universally promoted as healthy behavior, most people never question why they're so thirsty. We celebrate hydration. We remind ourselves to drink more water. So someone who is constantly drinking and still thirsty often thinks they're just doing the healthy thing. It takes a significant shift in thinking to ask, wait, should I actually be this thirsty? The compounding effect. There's another cruel twist. Many people with early diabetes reach for sugary drinks, sodas, juices, sports drinks, to quench their thirst. Why? Because the brain, desperate for hydration, often craves carbohydrate-rich fluids. But consuming more sugar drives blood glucose even higher, which makes the kidneys filter out even more water, which makes you even thirstier. The cycle deepens. When should you be concerned? If you've noticed an increase in thirst over a period of several weeks that doesn't correspond to obvious causes like increased exercise, heat, or salt intake, and if it's accompanied by any of the other signs we'll discuss today, that combination warrants a conversation with your doctor and a simple blood glucose test. Allow the weight of that point to settle before transitioning. Sign 2. Frequent urination, polyuria. This sign is directly connected to the first one we just discussed. They're almost always companions. If sign 1 is the engine, sign 2 is the exhaust. When your body is pulling excess water out of the tissues to flush out glucose, that fluid has to go somewhere, and it goes straight to the bladder. The medical reality. Normally, a person urinates somewhere between 6 and 8 times in a 24-hour period. People with uncontrolled diabetes can urinate 10, 12, even 15 or more times per day. And crucially, they urinate frequently at night, a symptom called nocturia. Waking up 2, 3, or more times during the night to use the bathroom is a significant clinical indicator. The urine in these cases is often notably different. It may be very pale or nearly colorless because it's so diluted with excess water. It may also, and this is important, have a slightly sweet or fruity odor. In fact, historically, before modern blood tests existed, physicians would actually taste urine to diagnose diabetes. The Latin word for diabetes, diabetes mellitus, literally means sweet-tasting siphon in reference to this very symptom. The body is quite literally excreting sugar. How this disrupts real life. Think about what constant, urgent urination does to a person's daily existence. It disrupts sleep severely. Poor sleep affects energy levels, cognitive function, mood regulation, immune function, and metabolic health. It creates social anxiety. People start mapping out bathroom locations before going anywhere. It interrupts work, meetings, exercise. It can become genuinely embarrassing. And here's the insidious part. Because frequent urination often accompanies other conditions, urinary tract infections, prostate issues in men, overactive bladder, pregnancy, many people don't immediately connect it to blood sugar. They get treated for the wrong thing while the underlying diabetes continues unchecked. The dehydration spiral. Losing so much fluid through frequent urination creates a state of chronic, mild to moderate dehydration. And dehydration itself creates a cascade of secondary symptoms. Headaches, dizziness, difficulty concentrating, muscle cramps, dry skin. These secondary symptoms then become another layer of noise, drowning out the original signal. What people tell themselves. I just have a small bladder. I drink a lot of water, so of course I pee more. I've always been this way. Getting older means you pee more. It's normal. Some of these explanations can be partially valid in isolation. But again, if the frequency is new, if it's increasing, if it's happening multiple times at night, and if it's happening alongside other symptoms we're discussing, that pattern deserves medical attention. A critical point about children. Sudden onset of frequent urination in children is a particularly urgent warning sign. Childhood and adolescent type 1 diabetes can develop very rapidly. A child who suddenly starts wetting the bed again after years of being dry, or who needs to leave class constantly to use the restroom, should be evaluated promptly. This is one case where parents should not wait. Sign 3. Unexplained fatigue and low energy. This is the symptom that tricks people the most. Because who isn't tired? In our modern world of 60-hour work weeks, screen addiction, poor sleep hygiene, and chronic stress, fatigue has almost become a badge of honor. We celebrate busyness. We normalize exhaustion. So when someone with early diabetes starts feeling unusually tired, they have an almost endless list of explanations to choose from. But diabetes fatigue is different. And once you understand why it happens, you'll understand why it's such a distinct and recognizable quality. The core problem: glucose can't get in. Here's the cruel paradox at the heart of diabetes. You are literally surrounded by fuel. Your bloodstream is flooded with glucose, and yet your cells are starving. Because insulin isn't working properly, the key can't unlock the door. Glucose is stuck circulating in the blood with nowhere to go. Your cells, desperate for energy, begin signaling distress. The result is a profound, bone-deep fatigue that doesn't respond to normal recovery strategies. This isn't tired because you stayed up late fatigue. This isn't tired because you ran a 5K fatigue. This is tired even after 8 hours of sleep fatigue. This is tired after doing nothing fatigue. This is I need to sit down after climbing one flight of stairs fatigue. It's different in character, and most people who experience it describe it as something qualitatively unlike normal tiredness. Contributing factors to diabetic fatigue. The cellular energy deficit is the primary driver, but it's compounded by several other factors. The chronic dehydration we discussed earlier impairs cardiovascular efficiency. Your heart has to work harder to pump thicker, more viscous blood. Frequent nighttime urination devastates sleep quality. The body's constant struggle to manage blood sugar is itself metabolically expensive. Inflammatory processes triggered by elevated glucose create systemic fatigue. And if blood sugar swings dramatically throughout the day, spiking after meals and then crashing, the person experiences unpredictable waves of energy and exhaustion that make it almost impossible to function consistently. The mental fatigue component. It's not just physical. The brain is one of the most glucose-hungry organs in the body, consuming approximately 20% of the body's total energy, despite making up only about 2% of body weight. When glucose metabolism is disrupted, cognitive function suffers dramatically. People with early undiagnosed diabetes often report what's been called brain fog, difficulty concentrating, poor memory, trouble finding words, slower reaction times, emotional volatility. They might feel mentally fuzzy for hours after meals. This cognitive impairment can affect work performance, relationships, and decision-making, all before a single doctor's visit has occurred. Why people ignore this fatigue is the great chameleon of medical symptoms. It's associated with depression, anxiety, thyroid disorders, anemia, sleep apnea, heart disease, autoimmune conditions, and a dozen other diagnoses. When someone complains of fatigue to a general practitioner, blood sugar is only one of many things to check. And people often don't even bring it up because they assume the doctor will tell them to sleep more and reduce stress. Don't let fatigue be dismissed without investigation. If your tiredness is persistent, disproportionate to your activity level, unresponsive to rest, and accompanied by any of the other signs in this video, insist on a metabolic panel. Sign 4. Blurry or fluctuating vision. Here's a sign that almost always gets attributed to something else: needing a new glasses prescription, or eye strain from screens, or just getting older. And while all of those things are real and valid causes of vision changes, there is a specific pattern of vision change associated with early diabetes that is distinct and important to recognize. The mechanism. Lenses that swell and shrink. Your eye contains a lens, a transparent, flexible structure that focuses light onto your retina. The shape of this lens determines the clarity of your vision. To maintain that precise shape, the lens must be kept at a very specific fluid balance. When blood sugar levels are elevated, osmotic pressure changes cause fluid to shift into the lens of the eye. This makes the lens swell and change shape. Specifically, it becomes more curved. A more curved lens focuses light differently. The focal point shifts, and suddenly things that were once sharp become blurry, particularly objects at certain distances. When blood sugar drops back down, the fluid shifts out of the lens again and vision may temporarily improve. This is why early diabetic vision changes are fluctuating. They come and go in patterns that correlate with blood sugar levels throughout the day. What this looks like in practice. You might notice that your vision is fine in the morning but blurry after lunch. or that it's worse on days when you've eaten more sugar or carbohydrates, or that it fluctuates week to week in ways that don't make sense given your normal glasses prescription, or that you're squinting more, struggling to read text that you read easily before, or experiencing mild headaches behind the eyes. Optometrists and ophthalmologists are often the first healthcare professionals to suspect diabetes before a primary care physician, because they see these lens changes in the eye exam. In fact, if you go to get a new glasses prescription and your optometrist says, your prescription has changed a lot in a short period of time, or if they need to keep remeasuring because your vision keeps shifting, that is worth raising with your doctor. The longer-term threat, diabetic retinopathy. The short-term blurriness from lens swelling is reversible and can normalize when blood sugar is controlled. But the longer-term threat is far more serious. Chronically elevated blood sugar damages the tiny, delicate blood vessels in the retina, the light-sensitive layer at the back of the eye. This condition is called diabetic retinopathy, and it is the leading cause of preventable blindness in working-age adults worldwide. The early stages of diabetic retinopathy often have no symptoms at all. By the time vision loss is noticeable, significant damage may have already occurred. This is one of the most compelling reasons why catching diabetes early, and the fluctuating vision sign is an early opportunity, is so critically important. Other eye complications. Diabetes also dramatically increases the risk of cataracts, clouding of the lens, and glaucoma, which involves increased pressure inside the eye. Both conditions can lead to serious permanent vision loss if not managed. And again, both can develop silently in the early stages. Your eyes are remarkable diagnostic windows into your overall vascular health. Don't neglect them. If you notice unusual changes in your vision, especially fluctuating clarity that doesn't fit the normal pattern of needing a new prescription, get a comprehensive eye exam and have your blood sugar checked. Sign 5. Slow healing wounds and recurring infections. This is one of the warning signs that most people brush off most casually, until for some patients, it becomes a devastating reality. Slow wound healing is not a minor inconvenience. In advanced, uncontrolled diabetes, it can lead to non-healing ulcers, serious infections, and in worst-case scenarios, amputations. But in the early stages, it shows up as something much more subtle. Why wounds heal slowly in diabetes? Wound healing is a complex, beautifully orchestrated biological process that involves multiple systems working in coordination, and elevated blood sugar disrupts nearly all of them. First, blood flow. High glucose damages the walls of blood vessels, causing them to become thicker and stiffer. This impairs circulation, particularly to the small blood vessels in the skin and extremities. Healing requires a rich supply of blood carrying oxygen, nutrients, and immune cells to the wound site. When circulation is compromised, that supply is reduced. Second, immune function. Elevated blood sugar impairs the activity of neutrophils, your frontline immune cells that rush to wound sites to kill bacteria and debris. When glucose is high, these cells become sluggish and less effective. So bacteria that would normally be quickly neutralized get to linger, multiply, and cause infection. Third, nerve damage. In early diabetes, nerve fibers, especially the small sensory fibers in the feet and hands, begin to be damaged by chronically elevated glucose. This means that minor injuries may go completely unnoticed. A small blister, a tiny cut, a piece of debris caught in a shoe, things a healthy person would feel immediately and address, may go undetected for days or weeks in someone with early neuropathy. By the time they notice, a significant infection may already be developing. What this looks like in practice. You get a cut on your hand that takes 3 weeks to heal instead of 1. You have a blister on your foot that gets infected despite careful care. You keep getting skin infections, boils, folliculitis, cellulitis, more often than seems normal. Women may experience recurrent yeast infections or urinary tract infections. You get thrush more easily. Gum disease that doesn't respond well to dental care. All of these are patterns of immune dysfunction that can signal elevated blood sugar. And again, because there are other explanations for each of these individually, people tend to treat each infection as a separate, unrelated event rather than recognizing a pattern. The feet. a disproportionate risk. The feet deserve special mention. They are farthest from the heart, meaning circulation is already working hardest to reach them. They experience daily mechanical stress from walking. They often have minor abrasions and pressure points. And in diabetes, they lose sensation first through neuropathy. Diabetic foot complications are catastrophic in unmanaged cases. The American Diabetes Association reports that every 30 seconds, somewhere in the world, a lower limb is lost as a consequence of diabetes. Nearly 85% of these amputations begin with a foot ulcer. And those ulcers often begin as small, ignored wounds that didn't heal properly. This is not meant to frighten you. It's meant to underscore that slow wound healing in early diabetes is not a minor symptom. It's a warning sign attached to serious consequences if ignored. Practical self-observation. Pay attention to how long your minor cuts and scrapes take to heal. If you have a small wound that isn't healing normally after 2 weeks, or if you keep getting recurring skin infections, or if you're noticing that infections seem harder to shake than they used to be, document it. Note when the wounds occurred, how long they're taking, and bring that information to your doctor alongside a request for a blood glucose test. Sign 6. Tingling, numbness, and burning in hands and feet. This sign is perhaps the most physically distinctive of all the warning signs we've discussed. It has a specific, recognizable character that, once you know to watch for it, is hard to dismiss. Though many people do manage to dismiss it anyway. What is peripheral neuropathy? The peripheral nervous system is the vast network of nerves that extends from your spinal cord and brain out to every corner of your body. Your fingers, your toes, your skin, your organs. These nerves carry signals in both directions, sensory signals from the periphery back to the brain, telling you about touch, pressure, temperature, pain, and motor signals from the brain outward, telling your muscles what to do. When blood sugar is chronically elevated, it damages these nerves through several mechanisms. First, excess glucose reacts with proteins in the nerve cells through a process called glycation, essentially gumming up the works and impairing function. Second, the tiny blood vessels that supply oxygen and nutrients to the nerves, the vasa nervorum, are damaged by high glucose, causing the nerves to slowly starve. Third, accumulated sorbitol, a byproduct of glucose metabolism, builds up inside nerve cells and causes them to swell and malfunction. The resulting condition is called diabetic peripheral neuropathy, and it typically strikes the small, fine nerve fibers in the extremities first, especially the feet and lower legs, and eventually the hands. This is why the pattern is often described as a stocking and glove distribution. It affects the areas covered by stockings and gloves before anything else. What it feels like. The sensations are diverse and can change over time. In the early stages, many people describe a tingling sensation, almost like the feeling you get when your foot falls asleep, but without the obvious positional cause. Or a burning sensation, like the skin is mildly on fire, even though it's not hot to the touch. Or electric shock-like jolts that come and go unpredictably. Or a sensation of wearing invisible socks or gloves, a muffled, slightly detached feeling in the extremities. As neuropathy progresses, numbness can develop, a loss of sensitivity to touch, temperature, and pain. And as we discussed in the last sign, this numbness creates its own dangerous consequences for wound detection. Symptoms are often worse at night when you're lying still, and there are fewer other sensory inputs competing for your brain's attention. Many people describe waking at 3 or 4 a.m. with burning or tingling in their feet that makes it difficult to fall back asleep. What people tell themselves, I must have slept in a weird position. It's probably poor circulation. I should walk more. I think it's from wearing tight shoes. It comes and goes. It's probably nothing serious. Occasionally, people do see a doctor about this symptom and get referred to neurology for a nerve conduction study, which may detect neuropathy, without ever being checked for diabetes. The diabetes is treated as secondary to the neurological finding, when in fact it's the primary cause. The urgency of this sign. Of all 7 signs we're discussing today, peripheral neuropathy may be the one that indicates the longest duration of elevated blood sugar. This is because significant nerve damage takes time to develop. If you're already experiencing tingling and numbness in your feet and hands, your blood sugar may have been elevated for quite some time. This makes it even more urgent, not less, to get tested immediately and to take the results seriously. The good news is that in early neuropathy, before significant structural nerve damage has occurred, blood sugar control can slow and sometimes partially reverse the progression. But the window of opportunity doesn't. Sign 7. Dark patches on skin, Acanthosis nigricans. And now we come to the warning sign that is perhaps the most visually obvious of all, and yet the most profoundly, consistently ignored. When cells throughout the body become resistant to insulin, the pancreas compensates by producing more and more insulin to try to force glucose into the cells. This creates a state of hyperinsulinemia, chronically elevated insulin levels in the blood, even before blood glucose necessarily becomes dramatically elevated. Here's the key. Insulin receptors also exist in skin cells called keratinocytes. When insulin levels are chronically high, these receptors in the skin are overstimulated. This overstimulation causes abnormal proliferation of skin cells. The cells divide and grow more rapidly than normal, and increased production of melanin. The result? Thickened, darkened patches of skin. Acanthosis nigricans. This is why Acanthosis nigricans is sometimes called a skin marker for insulin resistance. It's not causing a problem itself, it's not dangerous on its own, but it is a visible external sign that something is happening internally at the metabolic level. It can precede a formal diabetes diagnosis by years. Who is most affected? Acanthosis nigricans affects people of all ethnicities and body types, but it is significantly more common in people with higher body weight and particularly common in certain ethnic groups including Hispanic, Black, and Native American populations, groups that also have higher rates of insulin resistance and type 2 diabetes. It also appears more commonly in children and adolescents with insulin resistance, and its presence in a young person is an important predictor of future diabetes risk. Why this sign is so powerful. Unlike all the other signs we've discussed, which are internal, subjective experiences that require self-reporting, Acanthosis nigricans is visible. A knowledgeable healthcare provider who sees it during a routine physical exam should immediately order a metabolic screen. The problem is that many people, especially those without regular access to healthcare or those who don't mention the skin changes during visits, never have it evaluated. If you have dark, velvety patches on the back of your neck, your armpits, or your groin that have developed over months or years, this is not something to dismiss as a cosmetic concern. This is your skin sending you a biochemical message. Listen to it. What to do next? Your action plan. We've now walked through all 7 of the early warning signs of diabetes that most people ignore. So what do you actually do with this information? Let me give you a concrete, actionable plan. Step 1. Do a personal symptom audit right now, or as soon as this video ends. Take out a piece of paper or open the Notes app on your phone and honestly ask yourself, have I experienced any of the following? Unusual or persistent thirst that doesn't resolve with drinking water. Urinating more frequently than before, including at night. Unexplained fatigue or low energy that doesn't improve with rest. Vision that seems blurry or fluctuates, especially after meals. Wounds, cuts, or infections that are taking longer than normal to heal. Tingling, burning, or numbness in your hands or feet. Dark, velvety patches on the back of your neck, armpits, or groin. If you checked one of these, pay attention. If you checked 2 or more, this warrants medical evaluation soon. Don't wait. Step 2. Know your risk factors. Certain factors significantly increase the likelihood that elevated blood sugar is behind these symptoms. Be honest with yourself about whether any of these apply to you. Family history of diabetes. A parent, sibling, or grandparent with type 2 diabetes significantly raises your risk. Being overweight or obese, particularly with excess weight carried around the abdomen. Being over the age of 45, though, type 2 diabetes is increasingly being diagnosed in younger adults and even children. Having prediabetes previously identified but not actively managed. Being physically inactive. Having had gestational diabetes during pregnancy. Having polycystic ovary syndrome, PCOS, which is closely linked to insulin resistance. being of Black, Hispanic, Native American, Asian American, or Pacific Islander ancestry. The more risk factors you have alongside the symptoms we discussed, the more urgent your need for evaluation. Step 3. Get tested. The diagnostic tests for diabetes and prediabetes are simple, widely available, and inexpensive. Here are the key ones. The fasting plasma glucose test measures your blood sugar after at least 8 hours without food. A result under 100 mg/dL is normal. Between 100 and 125 mg/dL indicates prediabetes. 126 mg/dL or higher, confirmed on 2 separate tests, indicates diabetes. The HbA1c test, hemoglobin A1c, measures your average blood sugar level over the past 2 to 3 months. It reflects long-term blood sugar control rather than a single moment in time. An HbA1c below 5.7% is normal. Between 5.7% and 6.4% indicates prediabetes. 6.5% or higher indicates diabetes. Many doctors consider this the gold standard test because it isn't affected by what you ate the day before. The oral glucose tolerance test involves measuring blood sugar before and 2 hours after drinking a standardized glucose solution. This is particularly used to diagnose gestational diabetes and can identify people whose blood sugar regulation is impaired even when fasting values look normal. These tests require a blood draw, either from a lab order through your doctor or through direct-to-consumer testing services in many regions. If you're in the United States, Medicare and most insurance plans cover diabetes screening for people who meet certain risk criteria. Step 4. If you're diagnosed, act, don't despair. A diagnosis of prediabetes or early type 2 diabetes is not a death sentence. It is an opportunity. The research is unambiguous. Lifestyle intervention at this stage works. The landmark diabetes prevention program showed that modest weight loss, just 5 to 7% of body weight, combined with 150 minutes of moderate exercise per week, reduced the development of full type 2 diabetes by 58% in people with prediabetes. In people over 60, the reduction was 71%. The core elements of evidence-based diabetes prevention and management are reducing refined carbohydrates and sugar, increasing fiber through vegetables, legumes, and whole grains, achieving and maintaining a healthy weight, engaging in regular physical activity, both cardiovascular and resistance training, getting adequate sleep, managing stress, and working closely with your healthcare provider on any necessary medication. These are not radical, extreme changes. They are sustainable shifts that have ripple effects across every area of your health, not just blood sugar. Step 5. Share this information. Think right now about one person in your life who might benefit from this information. A parent, a sibling, a friend who's mentioned they've been tired all the time, someone you know who has some of these symptoms. Share this video with them, because one of the most powerful things you can do with knowledge is pass it on. Diabetes disproportionately devastates communities that have the least access to preventive healthcare information. Sharing evidence-based health content with people you care about in plain, accessible language is a genuine act of care. This is your wake-up call, and remember, your health is in your hands. We've covered a lot of ground today. We've talked about excessive thirst and frequent urination, your kidneys working overtime to flush out excess sugar. We've talked about the deep, qualitative fatigue that comes from cells being starved of glucose they can't access. We've talked about fluctuating vision and what it tells us about fluid shifts in the eye. We've talked about slow healing wounds and the immune dysfunction and circulation damage behind them. We've talked about the tingling, burning, and numbness in the extremities that signals nerve damage in progress. And we've talked about Acanthosis nigricans, the dark, velvety skin patches that are your body's visible external distress signal of insulin resistance. Each of these signs, in isolation, might be easy to rationalize away. But now you see them not as random, unrelated annoyances. You see them as a coherent language that your body is speaking. A language that says, the blood sugar system is under stress. Investigate. Intervene. Act. The most important thing I can tell you today is this. Early detection of diabetes is not a medical luxury. It is a decisive turning point. The same disease that can lead to blindness, kidney failure, heart disease, stroke, nerve damage, and amputation when ignored can be managed, slowed, and in its early stages often reversed when caught in time. You don't have to wait for a crisis. Your body is already talking to you. The question is whether you're going to listen. If this video helped you today, if it gave you information that changes how you think about your health or the health of someone you love, please share it. Like it. Leave a comment telling me which sign surprised you the most, or whether any of these resonated with your own experience. Your story might be exactly what someone else needs to hear to finally take action. I'll be here, making more content like this, because I believe that the most powerful medicine in the world is accurate, accessible health information, given freely to everyone who needs it. Take care of yourselves and each other. I'll see you in the next one.